Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another common questions during the interview. Where do you see yourself in 10 years? So in this question, actually it's very easy to answer, but here are some things we need to pay attention to. So interviewers actually want to know if you have a clear goals for your future. So typically they don't want to hire any people that don't have any clear goals in their future. So they want to hire people uh, with a clear with something in their mind, what kind of doctor they want to be and what they want to do in the future. And also, so for example, if you want to be a hospitalist, you want to see that after the residency training, uh, I would like to help my patient in the hospital, and I would like to see any different kinds of patient related to the internal medicine. So that's why I think a hospitalist is a good option for me. And if you want to pursue a primary care doctor in the future, so you probably see that because I'm more very interested in keep a longer relationship with my patient, and I really like to help people who is ill. So that's why I think a primary care doctor is my top option. Well, if you want to pursue fellowship in the future, you can definitely see that in the next 3 years, I would definitely complete my residency training first in order to pave the way for my fellowship training. So in the next 3 years, I would apply for the fellowship. You need to let them know which subspecialty you want to apply for. That would be much better. And then you can see that after all of the training, I would like to become a specialist and focus on this specific diseases, something like that. And if you are like me, want to be a physician scientist, so you definitely need to see something about the research. So like for example, for after 6 years training, including residency and fellowship, I will apply for a grant, and then I will lead a research team and build my own lab. So ultimately, I want to become a physician scientist in which subspecialty. So actually, also you need to pay attention that your answer should be based on different programs. For example, if you apply for the community program, and they don't have any fellowship opportunities, or they don't have any research opportunities, you definitely don't want to tell them that you would like to pursue and you want to do some research in that program, which is not a good answer. So here I will give you my answer for this question. So hi, Dr. Smith, can you please tell me your plan in the next 10 years? Yeah, of course. So to me, actually, it's pretty straightforward. As you know that I have already been trained as a cardiology, a doctor in cardiology uh, uh, for a couple of years in my home country. So in the first 3 years, I would definitely complete my residency training here in our program, and after that, I will continue my fellowship training in cardiology. And if I still have time during this 6 years training, I would I would like to continue my research and do some research, and also and after all of this training, I like to apply for NIH R1 grant and lead a research team and build my own lab and recruit the people who also interested in doing the research. And also I would like to pursue some mentorship, and I want to teach the student for what I have learned during this training, and ultimately I want to become a physician scientist in cardiology. So that's my answer. You see that I tell them my 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 future plan step by step. what's the first 3 year I want to do, and what I want to do in the next 3 years, and if I still have time, what else I want to do, like doing my research. And after that, I'd like to um, I apply for a grant and also build my own lab. And also I would like to pursue some mentorship, teach my student. So you see that I also tell them something about me, like I want to be a good teacher, and I'm good at teaching. I want to show the interviewers of one of my character. So that I think that's all from that's all for this topic. So good luck.